Hello, my name is Lucia Martinez. I am a physiotherapist, osteopathist, and specialize in the pelvic floor. So today I would like to talk with you about the pain, abdominal chronic pain, or dysmenorrhea pain, or endometriosis pain. Okay, there are a lot of pathology who provokes us a lot of pain in our daily life. So there are many treatments which can help us. With radiofrequency, for instance, we can recover this uncomfortable pain immediately because thanks to this current, we can benefit for this analgesic in immediately analgesic way and during analgesic. We have two types of analgesic in the same moment. If I am suffering with dysmenorrhea pain, for instance, I can treat it to get the inflammation goes out immediately, and I feel very comfortable in this moment, and I can treat my problem of the dysmenorrhea between the menstruation. Okay, to try to recover the normal movement of the tissues. And thanks to that, in the moment of the menstruation, I wouldn't have any pain. And during, if you are suffering endometriosis pathology, it's a very common, it's a pity, but it is like this. But we can help you to try to take out a lot of pain during the menstruation or even in the between of this moment. Try to stimulation the glands, the hormone glands, to get us analgesic during a lot of weeks. And we have another type of pain. It is very common after surgeries. Sometimes when we have to do some abdominal surgery or pelvic floor surgery, after that this injury has a fibrosis or adhesion. This is the worst we can have inside of us because this fibrosis provoke a tension, and it is the big problem inside in the stomach and in the digestive system. So after cesarean, after any pathology we need surgery, I advise you to treat this scar in the same moment you can arrive to the clinic. This scar and this fibrosis and this adhesion would be less a lot, and if you have this still, don't worry, we can get the elasticity of this tissue. Okay, thank you very much, and I try to help you. If we want to talk about the difference in incontinence, there are many common in women after the birth, but even that in young women who are practicing some sport very hard. Is it possible that this woman is suffering urine incontinence? There are two different incontinence more common. Okay, there is a lot more, but we are talking about only two, the more frequent. One of them is stress incontinence. The type of incontinence happens when the woman or men are doing some effort and the pressure goes directly to the bladder, and their muscles are not prepared to be closed, and the urine goes out without the detrusor. The detrusor is the muscle of the bladder is working. So it happens that I am working and I have a coffee and my urine goes out. So this problem we can treat, treating the muscles, and to learn the patient that the pressure must be directly to the posterior perineum, not in the anterior, because in anterior there is a bladder, and the bladder it isn't prepared to receive this pressure. So when I treat my patient, I have to teach them how to breathe and how to direction the pressure correctly, and besides that I have to improve a lot the muscle thanks WINBACK and another electrotherapy or another technique too. I recover all the muscle, the strong muscle, and I can stop this an uncomfortable urine incontinence. We have another type of incontinence. We talk about the urgency incontinence, and this type of incontinence, it is because the detrusor is working without my allowed. So it means there is a problem in the nerve system. So I can treat directly the bladder with the radio frequency. I have this electrode and I can choose the depth I want to treat. So if I use CET in normal way, I treat only the muscles. But if I change to deep CET, I treat directly to the bladder by the tummy, okay? So I can treat with heat, comfortable, not pain for the patient, not painful, and I can treat and increase the good metabolism and working of the detrusor muscle, okay? In the same way, there are another type of pathology, incontinence pathology, like gas or fecal. Normally, this pathology happens after the delivery, a traumatic delivery. In the same way, we can treat them with a lot of different techniques. Hi, morning. I would like to tell you what happens with the abdomen after a pregnant. During the pregnant, we are going to have a waiting, and our tummy is go fat, and our muscle is separating a physiological way, okay? But in the middle there is a fascia, and each fascia can stretch, suffering a stretch, a lot of stretching, and it could be broke. So it is very important after the birth to treat this area, because this area is a fascia very important for us, because if this area is broken or very slacking, we can suffer pain in our low back. We can suffer in the future a hernia, inguinal or hernia in abdominal, in anywhere, or we can feel pain in another part of our body, even our shoulder. So this part is very important. We can recover this part, this fascia, only with radio frequency. We can do exercise. However, the tissue we have to recover with radio frequency, because thanks to that we improve the metabolism and increase the collagen cells, okay? We can use this one in the very superficial fascia and increase very fast the heat, and when I am treating in a very high heat, I increase very fast. If I have my patient arrive to my clinic in very acute case, I can treat it, don't worry, because I can choose a key to decrease a little the intensity and the way how I am working with this frequency of the current. So I can treat it with this electrode. I can choose between surface or deep, and I can change the way the waves of the frequency are working. So in my opinion, I would like to treat all my patients directly after 2 or 3 weeks, more 6 weeks after the delivery, because I have the possibility to recover much better this tissue, because thanks to that we improve the metabolism and increase the collagen cells, okay? We can use this one in the very superficial fascia and increase very fast the heat, and when I am treating in a very high heat, I increase very fast. If I have my patient arrive to my clinic in very acute case, I can treat it, don't worry, because I can choose a key to decrease a little the intensity and the way how I am working with this frequency of the current. So I can treat it with this electrode. I can choose between surface or deep, and I can change the way the waves of the frequency are working. So in my opinion, I I would like to treat all my patients directly after 2 or 3 weeks, more 6 weeks after the delivery, because I have the possibility to recover much better this tissue. We are going to talk about the prolapse. This is a very common disease. It is very common after the delivery of our children, and a lot of women suffer this pathology. It is caused because the tissue is slacking, or sometimes during the delivery with the tools the doctor have to use to the baby goes out, have a damage in this tissue. So after that, the pelvic floor is a little sick, and the organs go out. Sometimes woman is suffering that there is something inside of their vagina, like a pressure or something, it wouldn't be there because the organs like bladder, uterus or rectum should be upper, but after the birth sometimes this tissue is very lacking or hard. So thanks to WINBACK, we can recover a lot this tissue and try to recover the good position in upper. We have 4 degrees in this pathology. Normally, when we have a prolapse grade 1 or grade 2, it's very easy for treat. We can use the radiofrequency to improve the metabolism and to try the collagen cells, new, born, and try to recover the tightening area. But sometimes if the prolapse is in 3rd or 4th degree, it's more complicated. However, it isn't impossible, so we can help, thanks to radiofrequency, to recover the normal position. I would like to tell you that when the woman is suffering this prolapse, normally it isn't painful, but it is very uncomfortable for them, for her daily life. So I would like to tell you that this pathology is very common. Please don't be quiet about that and try to recover your pelvic floor. Thank you.